Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Epiglottitis is a serious medical condition. It affects the epiglottis, a small flap of tissue in the throat. The epiglottis covers your windpipe when you swallow, preventing food and liquids from going into your lungs. When the epiglottis gets inflamed, it can block the airway, making it hard to breathe. Epiglottitis is a medical emergency and can be fatal if not treated quickly. Recognizing the signs and getting prompt medical attention is crucial. This condition can affect people of all ages, but it is most common in young children. Thankfully, with the widespread use of the Hib vaccine, cases of epiglottitis have significantly decreased. The most common cause of epiglottitis is a bacterial infection. Haemophilus influenzae type B, or Hib, is the bacterium often responsible. This bacterium can also cause other serious illnesses like meningitis and pneumonia. Other bacteria like Streptococcus pneumonia, known as pneumococcus, and Staphylococcus aureus, commonly called staph, can also cause epiglottitis. These bacteria usually cause infections in other parts of the body, such as the ears or sinuses. In rare instances, viruses like the flu virus or varicella zoster virus, which causes chickenpox, can lead to epiglottitis. Injuries to the throat, such as burns from hot liquids or swallowing a foreign object, can also cause inflammation of the epiglottis. Epiglottitis often starts suddenly, and symptoms can worsen quickly within hours. One of the most noticeable signs is a severe sore throat. The pain may be so intense that it's difficult to swallow. A muffled or hoarse voice is another common symptom. As the airway narrows, breathing can become difficult. You might hear a high-pitched whistling sound when the person inhales. This sound, known as streeter, requires immediate medical attention. Other symptoms include fever, drooling, anxiety, and restlessness. Children with epiglottitis often sit leaning forward with their chin jutted out, struggling to breathe. They may also appear pale or have a bluish tinge to their skin, indicating a lack of oxygen. Section 4. Diagnosing epiglottitis. Diagnosing epiglottitis starts with a physical examination. The doctor will look into the throat using a special mirror and a light. However, they will do this very carefully. Touching the back of the throat could make the swelling worse and block the airway completely. To confirm the diagnosis, the doctor might order a few tests. A neck X-ray can help visualize the swelling of the epiglottis. Blood tests can check for signs of infection. In some cases, the doctor might take a small sample of tissue from the throat to test for bacteria. It is crucial to remember that epiglottitis is a medical emergency. If you or someone you know has symptoms, do not try to look into the throat yourself. Instead, call 911 or your local emergency number immediately. Section 5. Treatment and management. Treatment for epiglottitis usually requires hospitalization. The first priority is to ensure the person can breathe. This might involve placing a breathing tube through the mouth and into the trachea or windpipe. This procedure, called intubation, helps keep the airway open. Once the airway is secure, the medical team will administer antibiotics to treat the bacterial infection. These are usually given intravenously or through a vein to ensure they work quickly. Corticosteroids, which are powerful anti-inflammatory drugs, can help reduce the swelling of the epiglottis. Most people with epiglottitis begin to improve within a few days of starting treatment. They can usually go home after a week or so. However, it's crucial to complete the full course of antibiotics as prescribed, even if symptoms improve sooner. Section 6. Preventing epiglottitis. Vaccination is the most effective way to prevent epiglottitis caused by Hib. The Hib vaccine is typically given to infants in a series of doses, starting at 2 months of age. It's also important to make sure older children and adults are up to date on their vaccinations. Good hygiene practices can also help reduce the spread of bacteria and viruses that can cause epiglottitis. This includes washing your hands frequently with soap and water, especially before eating or touching your face. Covering your mouth and nose when you cough or sneeze can also help prevent the spread of germs. Additionally, avoid sharing personal items such as utensils, toothbrushes, and drinking glasses with others. UMCC, your ultimate medical consultant connectors.